Ozempic is not magic. Weight can be lost and weight loss can be maintained with natural methods as well. I'm Dr. Rawat, a physician with over 25 years of clinical experience, founded healthgroupcoaching.com, and currently writing a book titled Slow Aging, Reverse Disease, and Optimize Weight. When talking about Ozempic, I find that the field is quite polarized. There is certainly a cult of Ozempic users out there. People who believe that obesity is a disease and Ozempic, and when I say Ozempic, I mean generic semaglutide, Wegovy, and sister drugs, cousin drugs like Mounjaro are the solution of that disease. On the other hand, I also find people on the opposite side of the spectrum. These might be natural gym bros who want you to follow the same kind of discipline, self-control that they have, and they see the usage of drugs like Ozempic or Mounjaro as some kind of failure. I believe that the truth is somewhere in the middle. Certainly, I don't belong to either one of these groups. I do prescribe Ozempic myself. Being a physician, I would prescribe it often for diabetes, for morbid obesity. But equally, I also coach in a program where the focus is on lifestyle, diet, exercise, and other kinds of parameters. So the message of this video is that while Ozempic is a fantastic drug for weight loss, it is not the be-all and end-all. Certainly, there are natural methods of losing weight. And even if you've had excellent results with Ozempic, you don't necessarily have to keep taking it in order to maintain your weight loss. I often see clients in my office who are on Ozempic because they have diabetes, their insurance company covers it, and so they're fine from that sense. But equally, I also see clients who are spending hundreds of dollars, if not thousands of dollars per month on semaglutide. Now, in some cases, these are wealthy clients, and for them, $1,000 a month is not a big deal. But I also see clients who are not very well off. I know they're struggling to make ends meet, but despite that, they're still spending hundreds of dollars per month on Ozempic. And this video, to be honest, is mainly directed at them, trying to educate those people who are spending hundreds of dollars per month maintaining their weight loss, that there is another way. You can do this naturally. And today, I'll be discussing 10 fundamentals of weight loss. It's important to understand how Ozempic works. Ozempic and drugs like Ozempic work on incretin hormones. These are hormones like GLP-1, which is glucagon-like peptide 1, as well as other cousin drugs which also work on other hormones like GIP, etc. Although they have various target organs, including your stomach, your gut, your brain, overall, what Ozempic does is slow down the transit time of your gut, cause some degree of gastric stasis, and give you a feeling of bloating, fullness, some degree of nausea initially, and generally it just promotes satiety. Satiety meaning a feeling that you are full and you don't need to eat. It also works on your brain, on the dopaminergic receptors, and hence it also has an effect on the pleasure that you derive from food. And certainly this may help with hedonic eating, which is eating where the main drive is to seek pleasure. This is more the case with ultra-processed, factory-made addictive foods. In fact, interestingly, Ozempic is now being investigated for its effects on other kinds of addictions, including alcohol addiction as well. I've had clients who felt that Ozempic did not work for them. And for most of these clients, they simply did not take a high enough dose. Often with Ozempic, you'll start at 0.25 milligrams once a week subcutaneous, moving up to 0.5 milligrams, 1 milligrams, Wegovy goes to 2.4 milligrams. If you get to a high enough dose, you will start feeling bloated, full, nauseous when you even see or smell food. The feeling would be very similar to ladies who have hyperemesis or nausea in pregnancy, where even the sight of food or the smell of food makes them want to puke. And once you get to a high enough dose that you're having that kind of effect, naturally you will start losing weight. So why do you lose weight? Is it some kind of magic? And that's the whole point. It's not magic. What that feeling of satiety and fullness and also the deprivation of pleasure from food does is mainly two things. It will cause some degree of portion control. So you'll start eating, but you'll stop eating faster, quicker. You'll have smaller portions because you don't feel like eating. And as it is, you're already full. And you may well end up skipping meals where you would normally have had a meal. And so you will start going longer without meals. So you'll start doing some degree of time-restricted feeding, which is a mild form of intermittent fasting as well. So through increasing satiety, through reducing appetite, Ozempic simply induces portion control and time-restricted feeding on clients. The calorie intake goes down, and that's how they lose weight. Of course, these clients can also, because they're feeling nauseous all the time, feel unwell, feel tired, and this could also explain why there can be an increased risk of muscle loss with these drugs. And this is why increasing protein intake and prioritizing resistance training is really important. There is also some animal studies suggesting increased risk of thyroid and gallbladder problems. And I do personally screen with an ultrasound my clients for their thyroid and gallbladder before starting them on Ozempic. The point being that it is its effect on your gastric stasis, intestinal transit, and dopamine pleasure centers in your brain that it induces a calorie deficit by causing you to have smaller portions and more time restriction within your eating. This, if you can organize yourself, if you can structure your day and your eating plan, is something that you can achieve yourself without Ozempic. I have seen clients on Ozempic who kept eating the same and did not lose any weight. Equally, I've also seen clients on Ozempic who then took a high enough dose to start feeling that feeling of fullness, bloatedness, nausea with food. And because that then induced a calorie deficit, started losing weight. So Ozempic is not some magic wand which will somehow increase your metabolism and make you lose weight. It essentially induces a calorific deficit. And this is something that you can do yourself with some planning, some structure, some guidance. So as a physician who prescribes Ozempic, but also as a physician who coaches on a health program, I'm not against Ozempic, but it's really important to understand that if you're part of a cult where Ozempic is the only solution and anything else would be unacceptable, bringing more discipline, structure into your life would be in some way an unacceptable thing to do, then I would like to discourage that kind of thought process. I'd like you to think that while Ozempic is a very useful drug to lose weight, in order to maintain that weight loss, there are things that you can do, and there is no reason why you should not try these things. Today, I'll be coaching you on the 10 fundamental things for weight loss. Make sure you watch the video till the end because the last tip might be surprising for you. What are the 10 fundamentals of weight loss? Number 1 would be to prioritize protein and fiber in your diet. This is a study in which the benefit of protein for weight management and for satiety is discussed. Protein among the main 3 macronutrients has the highest satiety scores, which means among proteins, carbohydrates, and fats, proteins give you the most feeling of fullness. And this is obviously beneficial for consuming overall less calories. Also, protein has the highest thermogenesis, which means the amount of calories that your body has to burn in order to break down protein and utilize protein is more than carbohydrates or fats. While those would be in the range of 1 to 5%, protein is almost 30% thermogenesis. So a third of the calories that you intake with protein is actually used up to break down that protein. And of course, maintaining fat-free mass or muscle mass is extremely important to have a faster metabolism. And so once you've lost weight, what will stop you from gaining the weight back to a large extent is the amount of muscle mass that you have, because it is that muscle mass which is metabolically active and will make your metabolism faster. This study looked at the effect of fiber on satiety and food intake, and they found that there was a 22% reduced food intake when satiety enhancing fibers such as beta-glucans, lupin, kernel fiber, rye bran, whole grain rye, or mixed high fiber diets were used. And so this was associated with lower body weight. This is why when I talk about consuming carbohydrates, I insist that this should be quality carbohydrates like whole fruits, whole intact grains, brown rice, quinoa, millets, steel-cut oats, or rye sourdough bread with flax seeds. Number 2 on our list for fundamentals of weight loss is to choose foods with low energy density or low calorific density. This table here shows the calorific density of various foods. And if you run your eyes down the table, you'll see that you start at around about 170 kilocalories per kilogram for lettuce, going down all the way to 8,840 kilocalories per kilogram for olive oil. Now, olive oil is a healthy food. Don't get me wrong. We use a lot of olive oil for Mediterranean diet, but Mediterranean diet is not a weight loss diet. It's a healthy diet. And if you're trying to lose weight, you need to be aware of what kind of foods will make you gain weight and have more calories. If you go down this chart, you will see that you can divide this into various categories. The first 5 or 6, that would be from the romaine lettuce down to the pineapples, would be from 170 kilocalories to about 500 kilocalories. These are mostly fruits with high amount of water and high amount of fiber. After that, from around 500 kilocalories to around about 1,300 kilocalories, you have other whole foods. These are more firm, they have less water, and hence they have more kilocalories, but these are still healthy. Particularly if you look at the brown rice and beans, these are good sources of fiber, protein, and healthy carbs. If you move up further from hard-boiled eggs, which is about 1,550 kilocalories, down to ground beef, which is about 2,700 kilocalories, you can see how these are more animal-based products, still whole food though, and the more fat which is contained within that animal-based product, as an example beef, the more calories it will have, which is why on my diet plan, I recommend that the protein intake should primarily be from beans, lentils, brown rice, Greek yogurt, fish, eggs, and lean white meats. Once you start moving up to red meats, of course, there are other dangers, including saturated fat, but these are also obesogenic. Once you move up further from a Big L, which is 2,870 kilocalories per kilogram, down to fruit and nut bars, you can see that these are now more processed, factory-made foods. In order to have a longer shelf life, they don't have much water or much fiber. In fact, these foods don't have much minerals, vitamins, antioxidants, etc. either, unlike the foods earlier on this list. And when you get to these so-called fruit and nut bars, you're getting up to 4,030 kilocalories per kilogram. And in the final group, you can see from croissants to olive oil, you're going up to 8,840 kilocalories. And these are typically fatty foods. And remember, carbohydrates and proteins are 4 kilocalories per gram, while fats are 9 kilocalories per gram. So if you fry something, if you add a lot of fat to any kind of food, you will be making it very fattening. So it will be obesogenic. The third fundamental of weight loss is avoid liquid calories with meals, in particular alcohol. This was a study investigating whether beverages with calories versus beverages with no calories would have a compensatory or additive effect to the total amount of calories. And what they found was the amount of calories that you would consume in that beverage was almost completely additive, which means if you had a 0-calorie Diet Coke, then you would not add any calories. But if you had 150 calories or 100 calories of Coke, then you would add 100 calories to that meal. In other words, the fact that a drink would have calories did not lead to any kind of compensatory reduction in the amount of non-liquid calories the people were consuming. Alcohol has a double whammy effect on the amount of calories you take in. Not only does alcohol increase the total amount of calories that you're consuming, it also, because of its effect on reducing self-control and self-inhibition, leads to overeating. I'm sure all of you have experienced this. If you have a drink before food, you always end up eating more than you would have had otherwise. And in this study, they demonstrated a significantly increased calorific intake in those clients who had alcohol with their food. Particular types of alcohol, such as beer, were found to be worse than other types of alcohol, such as red wine. And personally, I do recommend that if someone wants to have one small glass or half a glass of red wine every night, that is reasonable. But other forms of alcohol are really not that healthy. The fourth fundamental of weight loss is avoid foods with high glycemic index, which is foods which spike your sugar up fast. When we talk about glycemic index, we're talking about sugar and carbohydrates. What gives a food a low glycemic index is the amount of fiber and the amount of food matrix in that food. So a whole intact food will have a lower glycemic index than one which is not whole, so it has been broken up. For example, a kernel of wheat which has been put into a mill and turned into a powder, that'll have a higher glycemic index because there is no fiber, there is no food matrix, the body doesn't have to break it down. The sugar will rise faster into your bloodstream. When that happens, there are two main problems. Number one, as you can see on this chart, in foods with a higher glycemic index, let's say for argument's sake, if that blue line there is the amount of energy that your body required at that point of time. So your body will utilize the energy that it requires, but all the extra will go into storage. And when you have a food which spikes the sugar up fast, at that point of time, you will be pushing more energy into storage because your body doesn't require that much energy. The second problem with high glycemic index foods is that, as you'll see in this chart, the higher the peak goes, the lower the trough goes after. Your body produces insulin. The insulin pushes the sugar down. The sugar is forced out of the bloodstream into cells. But often this will be an overcompensatory mechanism. As a result, a few hours after that meal, your sugar will start going low. You'll start feeling more hungry, which is why if you have rice, sourdough with flax seeds, with eggs for breakfast versus having biscuits and cookies for breakfast, you'll feel hungry within a few hours of the cookies, while the food which contained a more whole, fiberful carb will make you feel full for longer. The fifth fundamental of weight loss is to avoid hyperpalatable factory-made foods. Ultra-processed foods are those foods which have been derived from food but are not real food. These are food products. They have taken pieces of the food. For example, the corn kernel from a corn cob has been turned into high fructose corn syrup. This is done in a factory, adding emulsifiers, preservatives, other kinds of chemicals to produce something which has a long shelf life, often mixing things together to make it hyperpalatable and addictive. So it's important to be able to differentiate between a true food and a false food, or rather a food product which is not made for your health, but rather is made to profit companies. This is the NOVA classification, and you can see on the left, you have unprocessed or minimally processed foods. And then as you go up the chart, you come to minimally processed foods, more processed foods, and then ultra-processed foods. Ultra-processed you definitely want to avoid, but as far as possible, try to stay on the left side of this chart, and all these health choices will be healthier on that left side. If this seems too complicated, just use the grandmother test. If your grandmother can recognize a food from the other side of the kitchen, then it's a healthy food. And if she can't, if it comes out of a box with a label which has more than 5 items which would not be normally within your kitchen, then it is an ultra-processed food. It's a food product. It is not meant for your health it's meant for your convenience, and it's meant for the bottom lines or profits of the companies which make these foods. Sixth fundamental of weight loss is to be mindful of stress, sleep disturbance, emotional eating, and hedonic eating. This is a paper in which the contribution of stress hormones like cortisol or glucocorticoids was described on obesity, particularly truncal obesity or fat around the belt line, and how stress hormones have an effect on your visceral fat. They have an effect on your insulin, leptin, which is your satiety hormone, ghrelin, which is your hunger hormone, and how this not only contributes to obesity, but also to the more dangerous form of obesity, which is truncal obesity, because it is that visceral fat which is metabolically active and is causative for insulin resistance, fatty liver, diabetes, etc. This study investigated how sleep restriction leads to increased activation of certain parts of the brain, which you could describe as more primitive parts of your brain. So essentially, you go into foraging mode when you haven't slept enough, and you then start looking for more hyper-palatable, high calorie density foods. So it showed how restriction in sleep leads to increase in calorie intake, and not only increase in overall eating, but also a predisposition to choose those foods which are less healthy. It is important to point out that if any client with obesity snores, then it's really important to be screened for obstructive sleep apnea. This is a condition in which your breathing is disturbed when you sleep because of snoring, and that leads to an inability to get deep stage 4 REM sleep. As a result, you wake up unrefreshed, and that can lead to 300 to 400 calories extra intake of food per day. It can also increase risk of heart disease. And so if you're obese and snoring, then please ensure that you do get screened for obstructive sleep apnea through a sleep test. It's also important to be aware of emotional eating and hedonic eating. Emotional eating is when you're feeling depressed, stressed, and you eat food as a result. It's important to be aware of that, so that once you start picking up on those cues, you can start putting it away and perhaps doing something else. It's also important to know about hedonic eating. Hedonic eating is when you have essentially become addicted to a certain type of food because it is hyperpalatable, it is factory made, it is extremely tasty, and you seek it out, you keep going back for it. And these are often high calorie density foods. And so it's important to be aware of that. And that is one way, or rather the first step of trying to stop that addiction, i.e. being aware, having insight. The seventh fundamental of weight loss is to prioritize aerobic as well as resistance exercises. I know many of you, and definitely a lot of my clients, would have put exercise first in their weight loss strategy, but the fact remains that diet will always be number one when it comes to weight loss. And this is because, try as you may, you really don't have enough hours in the day to burn enough calories to lose weight. The amount of calories you burn running on a treadmill for half an hour could easily be consumed by just having one can of soft drink. And so while exercise is extremely important, it is not the most effective way of losing weight unless you're a long distance runner or something like that. Equally, your non-exercise activity thermogenesis or NEAT is probably more important, which means taking the stairs instead of the lift, parking your car further away from the shopping center, walking more steps, trying to get 10 to 20,000 steps per day. Those things are probably more important. And resistance training or building muscles is extremely important, particularly because of the longer effect it will have on improving your metabolism, the amount of calories that you can intake which are utilized by your body. In this study, strength training was shown to be more effective than aerobic exercise at reducing sugar levels. There have been other studies which showed similar effects, as well as studies which showed that a combination of aerobic exercise and strength training is in fact more effective than either of them alone. The fact remains that muscles are a reservoir or a sink of sugar, and they also determine your metabolism. When you have more muscle, those need to be maintained. They take up calories to be maintained, and the amount of resting metabolic utilization that you have, i.e. whether your body requires 2,000 calories for sustenance per day or 3,000 calories per day, is primarily determined by the amount of muscle that you have. And so once you lose weight, one of the most important factors for not gaining that weight back is by having good muscle mass. Fundamental number 8 for weight loss is to enhance your gut microbiome to improve your metabolism. This study here describes the effect of gut microbiome on our health and metabolism. If you remember, we started this talk by talking about Ozempic and other drugs such as Wegovy, Mounjaro, and these are incretin hormones. Guess what your gut microbiome also produces? Those same incretin hormones, GLP-1, peptide YY. So dietary fiber is broken down by your gut microbiome into short-chain fatty acids like acetate, butyrate, and propionate, and through your intestinal L cells, is then utilized to produce incretin hormones like GLP-1 and peptide YY. This will then have an effect on energy metabolism, sugar metabolism, lipid metabolism, inflammation in your body, your immunity, as well as cancers. In my coaching session, I coach 8 classes, and one of those 8 classes is on the gut microbiome. But to summarize, to enhance your gut microbiome, you need to increase the amount of fiber that you're consuming, also increase the amount of healthy proteins you're consuming, so primarily plant proteins like beans, lentils, legumes, and also to increase the amount of fermented foods you're consuming. So this could be yogurt, kefir, kombucha, kimchi, sourdough bread, sauerkraut, tempeh, miso, etc. Fundamental number 9 is to practice early time restricted feeding, form of intermittent fasting. This is a mild form of intermittent fasting focused on eating early, not eating late. Earlier in this video, we started by talking about how Ozempic works, how it has an effect on your satiety, on fullness, on your appetite, and guess what else intermittent fasting does? In addition to helping you lose weight, improving your insulin sensitivity, blood pressure, reducing oxidative stress, it also reduces your desire to eat. It has been shown in studies that your hunger hormone, ghrelin, is reduced with intermittent fasting, and your satiety hormone, leptin, is increased in intermittent fasters. And so through intermittent fasting, you can achieve the same effects as a medication such as Ozempic. In my coaching program, I coach on ETRF, or early time restricted feeding. So I do recommend eating at a time when you're more insulin sensitive, when you're more active, and fasting at a time when you're more insulin resistant because your melatonin levels are higher and you are less active. So I would recommend to most people that you can finish your breakfast, which could be a smoothie or it could be a standard breakfast, by 9 a.m. And then they would be recommended to fast for anywhere from 14 to 18 hours. So if you have finished breakfast by 9 a.m., I would ask you to finish your dinner by 7 p.m. if it's 14 hours, by 5 p.m. if it is 16 hours, and by 3 p.m. if it is 18 hours. Most people will start at 12 to 14 hours. But if you're really trying to reverse disease, or if you're trying to speed up weight loss, then you would likely have to move up to 16 or 18 hours of fasting. And fundamental number 10 is to eat slowly, mindfully, with smaller portions, take breaks, and do not get distracted. Don't eat food in front of a television. Make sure you are focused on your food, you give respect to your food, you eat it in a structured kind of way, you give it proper time, chew slowly, because it takes time for the signals from your gut to get to your brain and tell you that you're full. Studies have shown it can take 15 to 20 minutes. And eating slowly, taking breaks, and being mindful of what you're eating can also allows for that gut-brain connection to develop and for you to realize in time that you're comfortably full. Also remember how the Japanese have this saying that they want to eat 80% to appetite. They want to be comfortably full. They don't want to feel stuffed. So if you're going for a all-inclusive buffet and want to stuff yourself, sure, I understand that. But don't get into the habit of wanting to feel stuffed for every meal, for every day. You should be aiming to feel comfortably full and just leave that stuffed feeling for that once in a few weeks all-inclusive buffet. I hope you found this video useful. Do share it with anyone who needs this kind of advice. I do coach on how to slow aging, reverse disease, and optimize weight. It's a 4-week program, 2 classes per week, 8 classes in total over a month. The 8 topics we cover on the course include causes of metabolic disease, obesity, and how to reverse it, intermittent fasting, optimizing nutrition leverage, anti-inflammatory diet to slow aging, gut microbiome reset to optimize metabolism, sleep and stress management, exercise and resistance training, and supplements to slow skin aging and reverse disease. The next batch will be starting in September. If you're interested, then go on my website and click on that subscribe button. So to summarize, I do not belong to any camp. I do not belong to the camp of people who prescribe Ozempic, Wegovy, Manjaro for a living, and for them, this is essential and the best thing since sliced bread. I also don't belong to the camp where these are natural bodybuilders who make a living out of encouraging you to improve your discipline, improve your self-control, and make major lifestyle changes. I'm somewhere in the middle. I'm a clinician with over 25 years of experience. I prescribe these medications primarily to my diabetic clients, but also for morbid obesity. But equally, I'm also a physician who studied nutrition at Harvard, who set up the website healthgroupcoaching.com, where I coach groups of people on Zoom video platform on how to slow aging, reverse disease, and optimize weight. And so I can see this from both sides. And what I want to say to you is that Ozempic works by inducing a calorific deficit. It does this by reducing your appetite. And because your appetite is reduced, you naturally start controlling your portions and also start skipping meals, hence doing some degree of time-restricted feeding. The point I'm making is that if you've lost weight already with Ozempic and this is not covered by insurance for you, or the costs are extensive for you, it is not that this medication works like magic. It does not have some kind of a metabolic speeding up effect on you. It works by making you eat less and eat less frequently. If you can use these 10 fundamentals that we discussed and consider my coaching program or see anyone else for coaching on this matter, then this is something that you could structure into your life, into your routine, and achieve successfully without Ozempic. Ozempic does not have to be a lifelong drug for you. Of course, if you stop it and start gaining the weight back, then you could always go back onto it if that's the way it happens. But there are natural ways of losing weight as well. Ozempic is a great tool for many people, but many people can also lose weight without Ozempic. I hope you found this video useful. Please do share it with any friends and family who may benefit from this information. If you'd like to know how to reduce blood pressure and how to reduce sugar, then click on the videos and I will see you at the next video.